Do you know what chickenpox is? No, we are not talking about this chicken and fox. Today, we are going to talk about an infectious disease called chickenpox. So let's find out. There's evidence of chickenpox dating back to ancient times, and the earliest known use of the term chickenpox dates to 1691, although it's not clear how it got this name. It's believed the disease was brought to the Americas in the 15th century by European explorers and settlers. Chickenpox infection is caused by the varicella-zoster virus. It can spread through direct contact with the rash. It can also spread when a person with chickenpox coughs or sneezes and inhale the air droplets. Chickenpox develops in stages. Before the rash appears, there may be fatigue or a general feeling of being unwell, fever that lasts 3-5 days and is usually less than 102 Fahrenheit, loss of appetite, muscle or joint aches, cold-like symptoms such as a cough or runny nose, headache. After these symptoms, the following will happen. An itchy rash will present on the face, body, or inside the mouth. The rash will develop in spots and sometimes can also appear on the eyelids or the genitals. The severity of the rash can vary. The rash will develop into fluid-filled blisters that will turn cloudy. These blisters may take 3-5 days to heal. As there may be many blisters, some may heal sooner than others. The blisters will become scabs. The scabs will fall off after about a week. Chickenpox used to be very common in the United States. In the early 1990s, an average of 4 million people got chickenpox and 100 to 150 died each year. The chickenpox vaccine became available in the United States in 1995. Each year, more than 3.5 million cases of chickenpox, 9,000 hospitalizations, and 100 deaths are prevented by chickenpox vaccination in the United States. CDC recommends 2 doses of chickenpox vaccine for children, adolescents, and adults who have never had chickenpox and were never vaccinated. Children are routinely recommended to receive the first dose at age 12 through 15 months and the second dose at age 4 through 6 years. Did you know that there are some home remedies for this chickenpox? Like, you can apply calamine lotion. Calamine lotion can help reduce itching. This lotion contains skin-soothing properties, including zinc oxide. You can serve sugar-free popsicles. Chickenpox can also appear inside your mouth. This can be especially painful. Encouraging a child to suck on sugar-free popsicles can be a good way to soothe mouth sores. As a bonus, this allows your child to get more fluids and avoid dehydration. You have to bathe in oatmeal. Oatmeal baths can be soothing and itch-relieving for chickenpox. Taking a bath won't spread the chickenpox from one area of your skin to another. Try some wear mittens to prevent scratching. Scratching your blisters may be tempting, but it can worsen your discomfort and expose your skin to infection. To prevent the temptation to scratch at night or during nap time, put mittens or soft socks over your child's hands. Trimming your child's fingernails so they won't damage affected areas can also help. Take baking soda baths. Another rich, relieving option to add to a bath is baking soda. Add 1 cup of baking soda to a shallow, lukewarm bath. Soak for 15 to 20 minutes. Your child can take up to 3 baths a day if they find this approach soothing. The best way to prevent chickenpox is to get the chickenpox vaccine. Everyone, including children, adolescents, and adults, should get 2 doses of the chickenpox vaccine if they have never had chickenpox or were never vaccinated. The chickenpox vaccine is very safe and effective at preventing the disease. Most people who get the vaccine will not get chickenpox. If a vaccinated person does get chickenpox, the symptoms are usually milder with fewer or no blisters and mild or no fever. The chickenpox vaccine prevents almost all cases of severe illness. Since the varicella vaccination program began in the United States, there has been an over 90% decrease in chickenpox cases, hospitalizations, and deaths. Some children and adults are at special risk of serious problems if they catch chickenpox. They include pregnant women, newborn babies, people with a weakened immune system. These people should seek medical advice as soon as they are exposed to the chickenpox virus or they develop chickenpox symptoms. They may need a blood test to check if they are protected from chickenpox. A doctor or nurse will know whether a child or adult has chickenpox by recognizing a person's telltale rash and asking a few questions about their symptoms. In cases when a person is not vaccinated and is not sure whether they have had chickenpox as a child, they can get a laboratory test to determine whether they did have the virus in the past. People who have had chickenpox as children will not get the disease again. This is because they develop immunity to the virus. If a person who has been exposed to someone with chickenpox is not sure if they had the illness as a child, getting tested can help them know if they are at risk for getting the disease. Another reason to get tested is to help a doctor distinguish the symptoms of chickenpox from other conditions with similar symptoms. One of those conditions may be shingles. If you've ever been infected with chickenpox, let us know in the comments below. You can subscribe to our channel to get informative videos related to health. Till then, stay with Health Coach.